Welcome back to Living 808. May is Stroke Awareness Month, and today we're focusing on stroke care. And there are some very common signs that we wanted to know about. So joining us now is Matthew Koenig, a neurologist, Florin Taflinger, program manager with the Department of Health, and Corey Chalk, Honolulu Emergency Medical Services Assistant Chief of Quality Assurance. Thank you guys so much for being here with tips. You guys have some tips for us and some really important information. So let's start off with you. If a person having a stroke, and this is actually really big because there's a lot of strokes that happen here in Hawaii. I know that stat. Why is it so important to call 911 right away?
Yeah, thanks for asking, John. A stroke is caused by blockage of blood flow to the brain, and every minute that goes by that the blood vessel is blocked, more permanent damage sets in. That could be paralysis on one side or trouble speaking. And so stroke care starts in the ambulance. It's really about calling 911 quickly, because then a healthcare professional comes to your home or wherever you're having that stroke, and the care of that patient actually begins in the ambulance before they arrive in the hospital.
Okay, that's really important.
It's incredibly important to call 911.
How does the ambulance connect to the hospital and make that connection? How does that work?
Yeah, that's a great question. So we're using technology now. We're actually using video telemedicine in the ambulance. So the neurologist and the emergency physician can begin collaborating with the paramedic and the patient in their home before they're even transported to the hospital. That's really important because there are different kinds of strokes, and we want to make sure the patient comes to the right hospital that can treat that patient for the particular kind of stroke they're having.
Wow, that's okay. That is really big. So what then is the state doing to burden ourselves of the stroke itself? Because there are a lot, and now I'm learning there's different types of strokes.
So stroke is actually the #1 cause of long-term disability and the 3rd leading cause of death in our state. So Hawaii is actually one of 13 state recipients who receives federal funding to support the Paul Coverdell National Acute Stroke Program. So it's really an important program for Hawaii because it actually improves the stroke system of care across the continuum. And so what that means is really looking at efforts focused on pre-hospital, so communication campaigns, emergency medical services, care and transport, to the inpatient clinical care, and then when patients are discharged and receiving rehabilitation and follow-up. And we're really excited because we've done some communication campaigns with the Hawaii Stroke Coalition, focused on educating the public about the common signs and symptoms of stroke and stroke treatment.
Can you tell me a little bit more? You mentioned it. Can you tell me a little bit more about the communications and media activity?
Sure. So in collaboration with the Hawaii Stroke Coalition, we launched a campaign last year focused on the common signs of stroke and the importance of calling 911. So the common signs of stroke can be remembered by the acronym BFAST. So B stands for any sudden balance loss or dizziness. E stands for any eye problems. So any loss of vision in one or more eyes or double vision. And then F stands for facial drooping. And then A is for arm weakness, so loss of numbness or weakness or inability to raise your arms. And then S is slurring of speech, so if any noticeable changes in speech. And then T, critical, is time to call 911. You know, stroke care really starts in the ambulance, and be fast for stroke and call 911.
Okay, that's really great for all of us to know. And if you missed it, we'll have that on our webpage, kh12.com, shortly after the show. What are some of the risk factors of stroke, and how can we prevent it? Is there a way to prevent stroke?
Sure. So the health conditions that can increase your risk for stroke are high blood pressure, high cholesterol, diabetes, history of cardiovascular disease or previous stroke. And important ways to prevent a stroke are maintaining a healthy weight, so choosing healthy food and drinks, exercising regularly, quitting smoking or vaping, and regularly checking your blood pressure, and then properly managing health conditions such as high blood pressure, high cholesterol, and diabetes.
Perfect. Okay, those are great to know. I guess one last thing I want to ask you is, what should someone know when calling a 911 dispatcher? What are some of the things that they should know?
Well, I think it's important to first recognize the symptoms of somebody having a stroke. Once they recognize those symptoms and call 911, our dispatchers are going to ask a couple of questions right up front, your address and your phone number, so we can start sending an ambulance right away. And if anything gets disconnected while we're talking to them, we can call that caller back. Because the dispatcher is going to stay on the phone for a long time, asking a set of questions, series of questions to figure out what's going on while the ambulance is being sent. Once the ambulance arrives, it's important for family members to wave us down, have somebody waiting outside to flag the ambulance down, try to get medications ready for the paramedics, the IDs, insurance cards. And it's really important, as Dr. Koenig had mentioned, to recognize these symptoms, because the longer it takes for them to call us, the longer it's going to take for us to get them to the hospital to get some of these critical treatments that they need. So recognizing those symptoms and being fast to call 911 is really important.
Thank you guys so much for being here. Really appreciate all the information, all of which will be on our website again on KHON2.com. Is there a place where we can find out more information about the coalition, a website, something that our viewers can go to and check it out?
At befast.hawaii.gov.
Thank you guys so much for being here. Really appreciate it. And there is a special. It's called Time is Brain, Navigating Stroke in Hawaii. And it's going to air on KHON Thursday on May 2nd at 9:30. We'll have much more on Living at 8 when we continue.